Hello, today I am going to discuss about oxytocin. These are the drugs which produce the uterine contractions. And the examples are natural oxytocin, ergot alkaloids, prostaglandins. And examples are prostaglandin E2 and prostaglandin 2 alpha. Synthesis. The oxytocin is a posterior pituitary hormone secreted by posterior pituitary gland, and the secretion occurs by sensory stimulation from cervix, vagina, and from suckling at the breast. So in this case, the oxytocin will be released when the stimulation occurs from the hypothalamus. There is a release of synthesized oxytocin from posterior part of pituitary gland to the target cells in the uterus and myoepithelial cells, which ultimately leads to uterine contractions and milk ejection. The pharmacokinetics is, it is not effective through oral route, administered intravenously, and also through the nasal spray. And metabolism, it is catabolized by liver and kidney, and in the distribution case, it is not bound to any plasma proteins, and its half-life is 5 minutes. The role of the oxytocin is, it stimulates both frequency and force of uterine contractility, particularly at the fundus segment of the uterus, and these contractions resemble the normal physiological contractions of the uterus, followed by the contractions which are followed by relaxation. As you can see in this graph, there is a frequency and the force of uterine contractions, and the relaxations are regular. And the immature uterus is resistant to the oxytocin, but the function of oxytocin in your uterus is, it will get only contracted at the term, and the sensitivity increases to 8-fold in the last 9 weeks of the pregnancy, and also 30 times more contractions in the early labor. Clinically, oxytocin is given only when the uterine cervix is soft and dilated. The mechanism of action includes the interaction of endogenous or administered oxytocin is with the myometrial cell membrane receptors, which promotes the influx of calcium from extracellular fluid or from the sarcoplasmic reticulum in the cell, and this increases the cytoplasmic calcium levels, hence stimulates the uterine contraction. As you can see in this picture, the oxytocin reacts with it binds with the receptor and then activates the secondary messengers, in which it will try to influx the calcium from the extracellular fluid, and hence there is an increase in the cytoplasmic calcium level, which contracts the smooth muscles. Now coming to the therapeutic uses of oxytocin, it is important in induction and augmentation of the labor if it's given through IV infusion. It is also given in the mild preeclampsia, uterine inertia, incomplete abortion, post-maturity, and maternal diabetes. This is also used in the postpartum uterine hemorrhage and impaired milk ejection. And in this case, it is given through the nasal spray, like a 1 puff in each nostril 2 to 3 minutes before nursing. So this is how the overall picture of how the oxytocin acts on a particular target. Coming to its side effects, the hypertension, uterine rupture, fetal death, water intoxication, and neonatal jaundice are the few side effects of excess amount of oxytocin. Contraindications, where it should not be given in the cases like hypersensitivity, prematurity, abnormal fetal position, evidence of fetal distress, and cephalic or cephalopelvic disproportions. And the precautions are multiple pregnancy and previous C-section if it's there, or the hypertension. Coming to the ergot alkaloids, examples ergometrin and methyl argonovin. So the effects of this ergot alkaloids on uterus is it induces the tetanic contractions of the uterus without relaxation in between, and these does not resemble the normal physiological contractions. As you can see here, there is only contraction without the interruptions of relaxations, and it will not only cause the fundus to get contracted, it will compress, or it also contracts the cervix part. So this is the major difference between the oxytocin and ergots. Coming to its pharmacokinetics, the absorption, it is easily absorbed by the oral route, so it can be given through the tablets and also given through the intramuscular route. It is extensively metabolized in the liver, and 90% of the metabolite is excreted in bile. The clinical use is when it has to be given, when the ergot alkaloids have to be given. In the cases of postpartum hemorrhages, like in the stage 3 of the labor, and the preparation includes the ergometrin 0.5 mg plus oxytocin 5 international units, and through the intramuscular route. The side effects are nausea, vomiting, diarrhea, hypertension, vasoconstriction of peripheral blood vessels like toes and fingers, and gangrene. Next is contraindications. It should not be given in the first and second stage of the labor, vascular diseases, impaired hepatic and renal functions, and it is also not given in the precautions, like precautions have to be taken when there is a cardiac diseases, hypertension, and multiple pregnancy. Coming to the prostaglandins, the mechanism of action is similar, that it contracts the uterine smooth muscles, and the difference is the prostaglandins contract the uterine smooth muscles not only at the term but also throughout the pregnancy, and it softens the cervix, whereas oxytocin does not soften the cervix. And prostaglandins have a longer duration of action than the oxytocin, and the therapeutic use is it will induce the abortion, induces the labor if there is a fetal death in the utero, then postpartum hemorrhages. The side effects are nausea, vomiting, abdominal pain, diarrhea, bronchospasm, and flushing due to the action on prostaglandin E2 and prostaglandin F2 alpha on the respiratory tract. Contraindications: it should not be given if there is a mechanical obstruction for the delivery and fetal distress, predisposition to the uterine rupture, and precautions are it should be precautiously given in asthma, multiple pregnancy, glaucoma, and uterine rupture. Coming to the uterine relaxants, so they are also called as a tocolytics, and the action is it will relax the uterus and arrest the threatened abortions or delays the premature labor. And the classification includes beta adrenoreceptor agonists, example is ritodrin, IV drug, and there is selective beta 2 receptor agonists, which are used specifically as a uterine relaxants. The mechanism of action is it binds to the beta adrenoreceptors, activates the enzyme adenylyl cyclase, which ultimately increases the levels of cyclic AMP, and that is reducing intracellular calcium level and decreases the sensitivity of actin and myosin contractile units. Hence, there is a relaxation of the uterine smooth muscles. And the side effects are tremors, nausea, vomiting, flushing, sweating, tachycardia, hypotension, hyperglycemia, and hypokalemia. Next is calcium channel blockers like nifedipine, and it also causes the relaxation of myometrium, and this is markedly inhibits the amplitude of spontaneous and oxytocin-induced contractions. The unwanted effects like Headache, dizziness, hypotension, flushing, constipation, ankle edema, coughing, wheezing, and tachycardia are some unwanted effects of calcium channel blockers when used at the term. Coming to the prostaglandin synthetase inhibitors, which stops the synthesis of prostaglandins, or depletion of prostaglandins will be preventing the stimulation of uterus. Examples like aspirin, indomethacin, and ibuprofen. Adverse effects are ulceration, premature closure of the ductus arteriosus. So this is about the oxytocins or tocolytics, and this is the reference. Thank you for watching, and if you like the video, please like and share, and if you're having any comments, please put it in the comment box. Thank you.